I'm an emergency medicine physician and I've practiced medicine for quite some time, but have always had an affinity for different modalities. I just realized that over time that there's so much more to medicine. It's not just giving someone a prescription, but it's really feeling the mind-body connection. And that was something that really attracted me to this course. And I use it in my practice and I love it. And I'm eager to learn just as much as everyone else.
That's Dr. Denise in our program. So, how did I go from having chronic pain to no pain and really just blowing the roof off of that milestone to having a baby, living a life of joy, discovering that this is my work and my purpose and my assignment and being able to help and support others? This is what I'm here to teach. So, we can dive into the teachings, grab a notebook. This masterclass is all about how I got out of chronic pain, ditch dependence on big pharma, and use the Calypso healing method. So, the first thing that we are going to cover is how do you take herbal medicine the right way? If you're popping plants, like you're popping pills, you're missing out. Number two is how do you choose the herbs that are going to work for you so that there's not so much hit or miss results? Everyone really does respond differently, but we have frameworks for being able to determine which plants are going to be more compatible with who we are. And then well-being brew number three is how do we pinpoint and address negative emotions that are the root causes of our pains? If we don't address the feels, we don't actually heal. So here we go. How do you take your herbal medicine the right way? And this is where we start. So few know that systematic reviews of hospital charts found that even properly prescribed drugs, aside from misprescribing, overdosing, or self prescribing, cause about 1.9 million hospitalizations a year. Another 840,000 hospitalized patients are giving drugs that cause serious adverse reactions for a total of 2.74 million serious adverse drug reactions. About 128,000 people die from drugs prescribed to them. This makes prescription drugs a major health risk, ranking fourth with stroke as a leading cause of death. We don't often read those statistics. And as much as there is information around plants aren't safe, you would never hear a statistic around plants sending 1.9 million people to the hospital. But here's where we start here, because unfortunately in our culture, big pharma's king. And so that means that we've really been conditioned to think about medicine, to approach taking medicine in a very certain way. And so often people are doing like a side by side comparison of drugs with plants. And then that means that they're questioning, well, are plants strong enough? Do they work? And the real problem is that people think it's like a one-to-one equivalent, thinking that, well, taking plants is the same as taking pharmaceuticals. And so instead of taking maybe one Advil or like two Advil or some pain relievers, you might say, okay, well, I'm going to drink 1 cup of tea and you're going to expect to have the same result. And depending on what that tea is, you're not going to have the same result. So now we begin to question the validity of plant medicine. And when we think that herbal medicine doesn't work or it's not effective when compared against pharmaceuticals, we're really speaking from a place of ignorance because we're dismissing thousands of years of intelligent use, research results on literally the oldest medical model of humanity. Plants and humans co-evolved. We literally, as human beings, would not be here if plants didn't work. And there's also tons of empirical evidence. There's tons of clinical research that exists, that's written, that demonstrates to us how effective plants can be. There are thousands of public and published reviews, trials, research on the pharmacological constituents within plants and how they affect the physiology of the body. So we keep having this debate, and it's an interesting one. I don't think that I can completely dismantle the debate, but I can at least try to help people understand that we shouldn't be doing a side-by-side comparison because they really are completely different modalities that can work together, but they're different in how they operate. So what else happens is that when we have this like one-to-one belief, I can just replace these two Advil with a cup of red raspberry leaf tea. It's like we're going to end up frustrated, discouraged, thinking that a life with pain, illness, disease is, or just thinking that a life with with pain, illness, disease is just what we are destined to have, thinking that holistic isn't for you. So we give up, assume that diseases are normal. And so something that I really want folks to understand is how they work. Zooming out, drugs force and plants help to prevent, restore, repair. Plant medicine does not work like pharmaceutical medicine. So when drugs enter our body, they are lab made, most of them, and they have very few ingredients that are designed to do a very specific thing. There's that active ingredient that's designed to give the body one set of one instruction. And so when plants enter our bodies, because they're literally comprised of thousands of chemical constituents, thousands of molecules. When they enter our body, they really do work in multiple ways to help restore, repair, and maintain our homeostasis. Of the more than 55% of Americans who regularly take prescription drugs, they are taking on average 4 different types of medications. Statistics show that when people start taking pharmaceuticals, they usually end up needing to take more, be it in the form of additional drugs or in the form of higher doses. And the reason this happens is because the drugs are forcing the body to do one thing. But your body doesn't work like that. It's always going to try to rebalance itself, counteract whatever the drug is doing. And as a result, the milligrams of the prescription have to go up, or instead of taking 2 over-the-counter pain relievers for recurring headaches, now you need 4. So as your body keeps trying to counteract the medication, the effects of the medication decline, then you need to take more of it. So you see how this begins to spiral? But the intelligence in plants is such that when they enter the body, they encourage the body's natural healing processes to take place. So the directions from plants are in essence like work more efficiently here, work better over here, versus the instructions from drugs are work the way I want you to work. They're forcing the body into a response. So on a fundamental level, plants support the body in doing what the body already knows how to do, but as circumstances would have it, be it lifestyle, diet, stress, emotions, the body isn't functioning and managing itself as optimally as it can. So plants help the body remember. Drugs are going to overwrite the body's internal instructions and self-management. Over time, drugs can help the body forget. Keeping in mind, keep all this in context of people, there are life-saving medications, right? So keep that in mind. And that there are genetic conditions for which people will need medications for the rest of their life. So we're kind of in the realm of lifestyle, preventable conditions, preventable drugs.